Hello beautiful peoples, Dr. Ahmed, we're back again with another video. Today it's going to be all about Aqualex or fat dissolving injections. I'm going to be answering your questions. Whilst you're here, might as well give us a little thumbs up, subscribe and drop a little comment. So there are injections that we use to help dissolve fat. So if you go back to your biology lesson, our liver produces bile that's stored in our gallbladder to help digest fat. So similarly with this, the fat dissolving injection is a derivative similar to bile. So it is made to digest fat in specific areas. So we can inject it in chin, love handles, tummy, legs, bum, arms, wherever you have fat, we can use it. If you think about it, it's like bile. So what it does, it physically destroys the fat cells permanently, and then you excrete them with your bodily functions. What we usually do is that we actually mix it with a bit of local anesthetic in the vial to stop any pain. But without that local anesthetic, it could be a little bit tender. Usually about 3 to 6. I always say get a course of 3 and then let's reassess after. In short, no. But actually, you will lose fat. Because if you think about it, fat weighs a lot less than muscle. So actually, even if you've lost quite a bit of fat, it can be a quarter of a pound really in weight. So you will lose the fat, not the weight. Which basically means the number on the scales might not be changing that much, but visibly, you're looking small. There are certain contraindications of this treatment like autoimmune conditions, skin diseases, and this is why I always say you need a consultation with a medical professional first. The main one really is an infection if the skin is not cleaned properly. Post-treatment, inflammation is normal. If anything, it's kind of wanted really. Because inflammation means your body is starting to attack those fat cells to get rid of them. So I always say for the first 2 weeks post-treatment, maybe don't make a lot of plans. It depends on the fat dissolver that they've used. The ones that I use in my clinic has the added benefit of actually tightening things up a little bit. So no, you won't be left with loose skin after. There are 2 main types in the UK, Aqualex and Belkyra. For our American viewers out there, Belkyra is the same as Kybella. It's basically just different name, but it's the same product. Depends on the number of sessions that you need, but usually from about 300 per session. I always say you start noticing results after your second treatment. We usually allow about 4 to 6 weeks in between sessions just to really get rid of the swelling. By far, the double chin. Because obviously as we age, we start losing a bit of our jawline, above our chin, and we start gaining a bit of fat there. So this area starts becoming quite problematic for a lot of people. The treatment essentially permanently destroys fat cells in the area. So, technically, those fat cells are gone forever. However, if lifestyle changes happen, you're eating more calories, you're not exercising as much, the remaining fat cells might get bigger.